4:15 in 3, 2, 1. Deramaxx is back, and after a little bit of an absence, it has come back to the forefront once again. Dr. Saylor.
Yeah, a little bit is being kind.
What was it, 10 years?
And, it's actually been
over 10 years.
Well, no. It was let's see, December 2011. We lost it.
Oh.
And it was basically, it wasn't any problem with the medication itself. There was issues with the production factory that product came out of. And
okay.
Interestingly, there was really no issues with the veterinary products that were coming out of that factory. It was the over-the-counter human stuff.
Oh.
But as a result, the whole factory was voluntarily shut down by the company. But as a result of that, that means several drugs, actually Interceptor and Sentinel, were no longer available to us, and those are still not back yet. But Deramaxx is now available back to us. Now, people say, well, what's Deramaxx? Well, for those of you that have osteoarthritic dogs, that was our workhorse for helping with chronic long-term pain and osteoarthritis. It was nice because it was once a day. Very safe drug, is what we call a COX-2 specific drug, which means it really only affects those receptors associated with pain mediation versus some of the spillover with gastric mucosa and kidney issues that we see with some of the other ones. Now, that having been said, there's no such thing as a safe NSAID, but theoretically the COX-2 specifics should be safer than the COX-2 selectives. But with a very much prolonged absence, we're happy to have that drug back and get it back into the hands of or paws, I should say, of the dogs that have osteoarthritis.
What were you using when it was off the market?
Well, we're having to go back to carprofen, and there's nothing wrong with carprofen. Carprofen's a great NSAID, but it's a COX-2 selective, and so we were using that. We were also using meloxicam. Those are all great drugs. Deramaxx, with the convenience of Deramaxx and being COX-2 specific, we just tend to favor that one a little bit more.
All right, and we'll be back right after this message.